All right, good afternoon, everyone, and welcome to the first webinar of the two-part tobacco prevention series geared specifically for community health workers, patient navigators, and other community-facing workers. This series is co-hosted by NYU Langone Health's Community Health Worker Research and Resource Center in partnership with the NYU Langone Health's Tobacco-Free Community. Both projects are supported by the NYU Langone Health Community Service Plan. My name is Dina Pimenova, and I'm the project coordinator for the Community Health Worker Research and Resource Center. And today I have the privilege of introducing our speaker, Binh Liu. In her current position, Binh is the research coordinator for the tobacco-free community in the Department of Population Health at NYU School of Medicine. She collaborates with community-based organizations to address high smoking rates among the immigrant population in the Lower East Side, Chinatown, and Sunset Park. Binh proactively works with community partners such as Asian Americans for Equality and Charles B. Wang Community Health Center to implement and deliver various health programs and interventions, including a community smoker navigator program and e-cigarette education. In addition, she is working on projects with community partners and Dr. Erin Rogers to reach NYCHA residents to have access to smoking cessation treatment. Before joining the Department of Population Health, Binh was the Director of Community Health Services at the Chinese American Planning Council. She worked with the HIV positive community for over 8 years, providing direct services to hard to reach Asian American Pacific Islander community members and other underserved communities who lack the resources and knowledge of locally available services. Dr. Erin Rogers will join us following the presentation during the Q&A portion of today's webinar. Dr. Rogers is an assistant professor in the Department of Population Health and studies gaps in tobacco treatment for smokers with psychiatric diagnoses and develops interventions to enhance the implementation of tobacco use treatment into behavioral health settings. Her research also aims to understand economic determinants and costs of tobacco use and to develop interventions that reduce financial insecurity as a barrier to cessation in low-income populations. Before we get started, I want to make sure to go over some ground rules. Please keep yourself on mute during the presentation unless you're volunteering during the interactive portion of the training. Please feel free to use the chat function to ask questions throughout the presentation. We will be collecting them for the Q&A session. The chat box is also open for comments and sharing of resources. The slides and the recording will be made available at a later date. And please be sure to fill out our evaluation questions at the end. And with that, Binh, the floor is yours.
Thank you, Dina, for the nice introduction. Welcome, everyone. So let's get started. We're going to talk about tobacco prevention with community members. Second, let me see. Today, this is the overview of today's presentation. We'll be sharing tobacco statistics in New York City, review the tobacco products and e-cigarette, the health impact of smoking and available resource for community members who wants to quit, using brief motivational interview to support smokers. Today's objective are to gain information to talk to community members about quitting smoking and learning about brief motivational interviewing skill. During the presentation, please jot down any question you may have, and we'll have plenty of time later to go over them during the Q&A sessions. Tobacco statistic in New York City. Why do we care about helping smokers quit? Smoking is the leading cause of preventable disease and death in the United States. 480,000 Americans die from smoking each year, compared to 37,800 from firearm-related death. Furthermore, smoking is a public health priority for New York City. Smoking is a leading cause of death in New York City. Estimated 12,000 New Yorkers dies from a smoking-related illness every year. There are over 860 people who smoke in New York City. Up to half who smoke long-term will die from a smoking-related illness. There is good news. This graph shows an overview of 38% decline in smoking prevalence in New York City between 2002 and 2016, which align with the implementation of policy and other initiatives across the city, such as tax increase, at various times. The Smoke-Free Act of 2002, protecting New York City workers from secondhand smoke by making workplace smoke-free. And as you may also remember, in around 2002, the New York City State Clean Indoor Act prohibits smoking indoor in establishments like restaurant, bar, and theater. And flavor law, like in 2020, New York State legislature called for a ban on all flavor cigarette sales, including mint and menthol flavor. At the same time, we have also seen a widening of smoking disparity by sex. Smoking is currently about twice as common among men than women. There are almost over 200,000 more men than women who smoke in New York City. The disparity by sex is something we see across racial and ethnic groups, but the difference is significant between Asian men and women. 22.1% of Asian men smoke as compared to 3.1% of women. We also see how Black and Asian men have a higher prevalence of smoking than white and Latino men. Black women smoke more than any other group of women. NYCHA resident and smoking. About 19% of NYCHA residents smoke, significantly higher than the overall smoking rate in New York City, which is 13.4%. NYCHA residents have a higher rate of various tobacco-related disease than non-NYCHA residents. In 2018, the Department of Housing and Urban Development required all public housing to have a smoke-free policy in place in order to create a healthier environment. The use of cigarette, cigar, pipes, and hookers pipes anywhere inside public housing, which include apartments, and within 25 feet of any NYCHA's building is not allowed. However, there are support. The Smoke-Free NYCHA, an initiative, was created to work with residents and NYCHA employees to reduce exposure to secondhand smoke and provide support to help people who are interested in quitting. 44% of New Yorkers are exposed to secondhand smoke that comes from outside their home. Even brief exposure can be harmful to your health. Secondhand smoke contains deadly chemical and can move between apartments. So that's why sometimes you smell smoke, in an apartment, even though you're not smoking, because the smoke do travel between apartments. E-cigarette use among New York City high school students. According to data from New York City Youth Risk Behavior Survey, e-cigarette use prevalence among New York City school students by sexual identity. There is a higher rate of smoking among high school students who identify as gay, lesbian, bisexual than straight high school students. This is due to tobacco industry making effort to appeal to LGBT consumer through targeted marketing. Tobacco products and e-cigarette. Tobacco product comes in many types. People can smoke, chew, or sniff tobacco. Smoked tobacco products include cigar, cigarette, BDs, are small, thin, hand-rolled cigarettes, and kete are unfiltered cigarettes of Indonesian origin. Some people also smoke loose tobacco in a pipe or a water pipe, called hookahs. Chew tobacco products include chewing tobacco. You can sniff it, dip them. They are called smokeless tobacco, which are referred to products that are either sniff, suck, or chew. Smokeless tobacco are products that are not considered safe alternative to smoking. Some contain more nicotine than cigarettes, making them more addictive. At least 28 cancer-related chemicals has been found in smokeless tobacco. What's in cigarettes and cigarette smoke? A cigarette is filled with shredded tobacco leaf that has been processed with various chemicals. There are also multiple additives for preservation, but also to add flavoring and making the tobacco smoke less harsh. After this is all put together, it is filled with a paper tube that has a filter at the end. You can see, for a few examples, some of the chemical in cigarette smoke and the other common substance that they are found in our daily life, like carbon monoxide, which is that are found in car exhaust fume, and arsenic, which is found in rat poisons. What's in cigarette smoke? When you light a cigarette, the process of burning what's inside of it including the tobacco and other additives, generate over 7,000 chemicals in the smoke, including over 69 carcinogens, all chemicals that are known to cause cancer. Oh, I forgot one thing. Nicotine itself is not carcinogen, but it is the substance that causes addiction. That's the key. It's the nicotine that causes the addiction. Overall, cigarette smoking is decreasing, but menthol cigarettes use is increasing. Menthol is a minty flavor substance added to tobacco product that hides the harshness of smoking. Menthol cigarettes are just as harmful as non-menthol cigarettes, but the menthol additive makes it easier for teens to start smoking. The tobacco industry advertises menthol tobacco product to teens and community of colors. In New York City, 85% of Black people who smokes and 64% of Latino who smoke use menthol cigarettes. The tobacco industry marketing message implied that menthol cigarettes are a healthier alternative. Before we move into e-cigarette, I want to take a quick poll. Which has more nicotine, one jewel pod or one pack of cigarette? I'll give everyone a few seconds to vote. It's good? Okay. Great. All right, so seems like 63% got the same amount. You guys are expert in tobacco product. Yeah, I don't need to continue anymore, right? Just joking. Yes. So let's continue with the presentation. Thank you for voting. And let me close this first. Great. Yes. So e-cigarette is a device that contains a liquid that is heated by battery, and that vape is inhaled into the lungs. The e-cigarette contains nicotine, flavors, and other chemicals which are dangerous to the body. Some e-cigarette looks like regular cigarettes, cigar, or pipes. Some look like USB flash drive, pens, and other everyday items. Using an e-cigarette is sometimes called vaping. So what is in e-liquid? E-liquid are made of nicotine, flavoring, and additive and solvent. Flavoring, a lot of flavor are artificial and was made with intention for ingestion, not for inhaling. We have nicotine, VG, a chemical that helps produce the aerosol, PG, a preservative, which breaks down into cancer chemical, causing cancer chemical. Scientists are still learning about the long-term health effect of e-cigarette. Some of the ingredients in e-cigarette aerosol could also be harmful to the lungs in the long term. When you inhale the vape, ultrafine particles that can be inhaled deep into your lung. We can also inhale heavy metals such as nickels, tin, and lead. E-cigarette comes in various flavors, include fruits, candy, mint, and menthol. E-cigarette comes in various flavors, as I said, because they use flavor as a marketing to make it appealing to the youth. Enhance the rewarding effort of e-cigarette is a primary reason for youth to use e-cigarette. A study from 2013 to 2014 shows that most youth who use e-cigarette first start with a flavor, and flavor are the primary reason youth report using e-cigarettes. Health impact of smoking. Smoking harms nearly every organ in our body, cause many diseases, and prevent us from living a healthy and productive life. Smokers are more likely than non-smokers to develop heart disease and strokes and lung cancer. This animation shows how smoking can cause cancer in different parts of our body, from mouth cancer to stomach cancer. Anyone who's exposed to secondhand smoke are inhaling the more than 7,000 chemicals in tobacco smoke. Even if you have never smoked, exposure may cause heart disease and lung cancer. For children who breathe secondhand smoke, are sick more often with pneumonia and ear infection, and grow up with a weaker lung. Smoking, vaping, and COVID. COVID-19 is an infectious disease that primarily attacks the lung. Smoking impacts lung function, making it harder for the body to fight off the disease. Being a current smoker increases your risk for severe illness from COVID-19. Vape can affect lung health that may increase the risk of severe illness from COVID-19. This is still being studied. Sharing vape pen and other tobacco products with others can spread infection like COVID and flu. What is the cost of smoking? In New York, the average cost of a pack of cigarettes is $14. A pack a day habit adds up to $420 per month or $5,040 per year. When you do the math, you can do a lot with $420 a month. The economic benefit of quitting is a good motive for smokers to consider. For example, if you purchase one pack of cigarettes per week for a year, that adds up to $728. That's equivalent to buying 2 months worth of grocery. Many smokers will say, oh, it is too late to quit. I have been smoking for so many years, so my body is damaged already. It is never too late. The immediate impact is visible. Over time, people who quit will see many changes to their body. After 24 hours of quitting, the nicotine level in your blood drops to 0. Several days of quitting smoking, the carbon monoxide level in your blood drops to non-smoker level as well. 1 to 12 months, that's a year after quitting, your coughing and shortening of breath decrease. After 2 years after quitting smoking, your risk of heart attack drops sharply. 10 years after you quit smoking, your risk of cancer of mouth and throat drops by half. So quitting smoking has benefit at any age. It doesn't matter how long or how much you have smoked. Treating tobacco dependence. As I said earlier, nicotine is the cause for addiction. So cigarette and e-cigarette both contain nicotine. So nicotine is the root of tobacco dependence. Tobacco is the main addictive substance in tobacco and e-cigarette. Research suggests that nicotine may be as addictive as heroin, cocaine, or alcohol. Nicotine causes addiction, not the long-term disease. Nicotine leads to actual physical dependence. Nicotine can harm the developing youth and young adult brain as the brain keeps developing until the age of 25. It may affect the part of the brain that controls attention, learning, mood, and impulse control. People ask, why is this so hard to quit? Tobacco dependence is a chronic condition that requires a two-part approach for maximizing treatment effectiveness. Prolonged tobacco use in tobacco dependence, which is characterized as physiological nicotine dependence, is the addiction to nicotine, and the behavioral habit of using tobacco. Addiction can be treated with FDA-approved medication for smoking cessation, and the behavioral habit can be treated through behavior change program, such as individualized counseling or group or online cessation program. Treatment should be address both the physical and behavioral aspect of dependence. Do you ever wonder what happened to your brain when you smoke a cigarette? Nicotine is an addictive drug that changes the way your brain works. In order to understand how nicotine dependence works, I want to explain addiction pathway. Nicotine causes a massive release of dopamine. Dopamine is a drug, it's a brain chemical that is released when you do something enjoyable or pleasurable, like eating a good meal, laughing at a good joke. It is this response to nicotine that causes the brain to release massive dopamine. It is potentially very addictive, to be addicted to dopamine, which is the result of the nicotine. Nicotine reaches the brain in 11 seconds. That's very fast. So tolerance. Tolerance when your body gets used to having a drug around so that you need to use more of the drug to get the same effect. So every time you smoke, you get that feeling of reward. So we would do more, we would do it more. This creates an unhealthy pattern as nicotine tricks the brain into activating this feeling of enjoyment of each puff. Over time, the body needs more to get the same effect. So your body becomes a state in which the brain no longer responds to the drug, so you need more and more of the dosage to get the same effect. Dependence. When your body gets used to having a drug around, so that you need to use the drug in order to feel normal. The longer you smoke, the more and more dopamine, the feel-good chemical, is released. Over time, the body learns that it needs nicotine to feel good, but it can never get enough. Withdrawal. Once drug dependence occurs, if you abruptly stop or decrease the use of that drugs, your body can develop symptoms as if you are sick. In the case of nicotine withdrawal, one can experience anger, anxiety, depressed mood, difficulty sleeping, hunger, craving. But most symptoms last for about 2 to 4 weeks and then start to decrease. So how can people quit smoking? Counseling and medication are effective when used by themselves for treating tobacco dependence. The combination of counseling and medication, however, is more effective than alone. Medication can deal with physical dependence, but joining a quit program can provide additional emotional and mental support. Cold turkey never works most of the time. It's based on willpower to quit. It's the least effective. And the most effective is counseling and using medication. NRT, nicotine replacement therapy. NRT is one of the most helpful tools smokers can use to quit. Research shows that NRT is safe and effective. NRT can help with the difficult withdrawal symptoms and craving. NRT gives you a small amount of nicotine without the dangerous chemical found in cigarettes. NRT comes in various forms that are used in different ways. NRT is safe and effective for adults, except pregnant women and teens. FDA-approved medication, double the chance of quitting. So FDA approved 7 types of NRT. There's the over-the-counter, which is the nicotine gum, nicotine lozenge, nicotine patch. However, you will need a prescription from your medical provider for the nicotine nasal spray, the inhaler, and the Zyban, which is bupropion, and Chantix, which is the brand name for varenicline. Be sure to tell the community member to talk to their primary care doctor and let them know that they're interested in quitting so that they can discuss the best NRT option for them. But also let the community member to let the provider know that they receive NRT from a cessation program so that it doesn't impact any of the medication that they're also taking at the same time. FDA has not approved e-cigarette as a quit smoking aid. More research is needed on whether e-cigarettes are effective for quitting smoking and the health impact of e-cigarette. Common misconception about NRT. Why should I use NRT to quit? Isn't nicotine harmful? NRT is not what causes disease. It is the other chemical in smoke that causes disease. Isn't using NRT just trading one addiction for another? NRT presents a much lower risk for addiction. NRT provides the nicotine to prevent withdrawal without the 7,000 harmful chemicals. Other misconception. NRT doesn't work. I tried it before and it doesn't get rid of my withdrawal symptoms. NRT works best when using 2 types of NRT. It could be patch with gum, patch with lozenge. Providing sufficient doses greatly reduces withdrawal symptoms. For example, as I said earlier, using the patch produce a steady doses of nicotine throughout the day. Adding a short-acting NRT such as gum or lozenge provide a boost of nicotine when the smoker needs it most. Best result achieved with a minimum of 12 weeks, is 3 months. Most people are not as patient, so after 1 or 2 weeks, they give up. But it's good to let them know that at least a minimum of 12 weeks is the best. NRT achieved the best result when combined with a personal quit plan to help you deal with these symptoms and address trigger and craving. Great. Next, we'll address the behavior aspect of tobacco dependence and using motivational interviewing skills to support smokers in their quit journey. Motivational interview, MI. So MI is a method where a patient explores and resolve uncertainty about making a behavior change. It is a collaborative process designed to strengthen personal motivation for and commitment to a specific goal. Focus on smoker needs or concern, give them responsibility for change, while also providing a set of alternative strategies for change. Minimizing the smoker resistant. We usually focus only on smoker ready to quit, but 80% are never ready to quit in the next 30 days. Instructing these smokers on how to quit create resistance all the time. This mismatch led to a new motivational-based intervention approach. A smoker motivation is their readiness to quit. Your job is to move the smoker along the continuum of readiness to change and maintain that motivation to encourage in that process. This is best done with empathy, smoker-centered treatment philosophy. The way you approach a smoker can have a significant impact of acceptance to treatment. Brief interaction can be effective when patients' concerns and needs are realized, and messages are tailored to address their concern and desires. Goal of MI, strengthen motivation for changing behavior. Engaging smoker in the stage of change. Pre-contemplation, I have no interest in quitting smoking. Contemplation, oh, I want to quit, but I really like smoking. Determination and preparation, I'm ready to quit smoking. Action, I don't smoke anymore. Maintenance, I'm a non-smoker. Relapse, I blew it, I'll never stop smoking. For a client who are in the contemplation or preparation stage of quitting, you can heighten their desire by using motivational interview. It is important to understand where people are at, understanding client readiness to make changes, appreciating barriers to changes, helping client anticipate relapse can improve client satisfaction and lower their frustration during the change process. Pause is a technique used to increase motivation, and it is a client-centered approach. Using open questions to gain an understanding of your client's daily life, affirming the client by sharing a belief that they can be responsible for their own decision and life choice. Reflective listening, listening to your client to help gain a deeper understanding of their life. Summarizing, checking that you understand your client goals and preference. Why might you want to ask patient open voice closed question? Well, closed question answers are probably short, yes or no, and provide very little information. Open questions are answers are longer, gather more information, and have an opportunity for the patient to express themselves more freely. Example of closed and open question. Do you want to stop smoking? Instead, ask, what are your thoughts and feelings about stopping smoking? Do you think you can manage craving? Instead, ask, what do you think might work to help you manage your craving? Do you think you will gain weight if you quit smoking? Ask about, what concern do you have about quitting smoking? So avoid setting up yes and no response. Instead, use words such as how, what, and when. For example, what are your thoughts about quitting smoking? What was it like for you when you last quit? Next, we're going to do a role play exercise. We need 2 volunteers. Is there anyone who wants to volunteer? If you want, please unmute yourself. One can be the navigator and one could be the community member. Anyone? Dina, and then?
Great, I can go. Is there anyone else who would like to join me?
If you want, I could be the navigator and you could be the community member. How about that?
Sounds good.
Would it be okay if I talk to you about smoking?
Yes, I have been thinking about quitting for a long time. I am ready.
What stage is this community member in? And we can put it into the chat. So this community member is in preparation stage. So the navigator could respond to this community member in preparation stage by creating a quick plan, offering the community member information and resources such as talking to the doctor about medication, calling the quick line, or referring to a local cessation program. Okay, Dina, you want to go again? Would it be okay if I talk to you about smoking?
Yes, you can talk to me about it, but are you going to tell me something I don't already know? I know I should quit because it's not healthy, but it really makes me calm.
So, what stage is this community member in?
Let's see. So for this this community member, it's probably in the contemplation stage. So this is somebody that is at least open to talking about smoking, but they have a bit of ambivalence. So they know it's not healthy, but they're also saying it really makes them calm. For this community member, you probably would not jump in to start offering them resources. You would want to really just explore what they like and don't like about smoking, using those open-ended questions to try to help them explore and move them along in their stage of change to hopefully get them to determination or preparation, at which point you could start offering them some resources. Next slide. So just some additional tools to help smokers who are not ready to quit. These can be the majority of smokers that you encounter. A good model is what's called the 5 R's. This can help support motivation for quitting for people who are not quite ready to make a quit attempt. So this just involves going through a conversation with the community members around these 5 R's. So the first is having a conversation around how smoking and how quitting smoking is relevant to them and their own personal lives. So this could be their personal health issues, this could be the health of their family, or like Binh mentioned before, sometimes the relevance is financial. Folks are, particularly in New York City, it's very expensive to smoke, and so the relevance could be financial as well as health. The second R is to have a conversation around the risks. This can be, again, the risks of using tobacco or using e-cigarettes, going over the health harms that Binh had mentioned previously. And then the third R is rewards. So this is really having a conversation with the community members around all of the different benefits of quitting. So this could be health benefits, financial benefits, or it could be just personal, feeling good about making a change in their lives. Another R, the fourth R, is repetition. So if you see community members regularly for follow-up visits or check-in visits, it's a good idea to check in about their smoking and just to remind them at every visit that you're here to help them with their smoking whenever they're ready. And then the last R, which comes up a lot in conversations about smoking, is roadblocks. So these are barriers that folks encounter in terms of their progress around trying to make a quit attempt and in particular, trying to avoid relapse. And so just having a conversation around, what was it like last time you tried to quit, or what came up in the last week for you that made it difficult to quit, and then helping the community members generate solutions to those barriers that are feasible and kind of personally rewarding for them, can help them along in their motivation. Next slide. And so lastly, we just wanted to give some information about resources that can be helpful to talk about community members with once they do get to the point of wanting to discuss a quit attempt. So like Binh mentioned, that there are FDA approved medications for smoking cessation. New York State Medicaid currently covers all of these medications. They do require a prescription from a healthcare provider. So if somebody wants to use the medications, using their Medicaid, they do need a prescription to do that. New York State recently expanded their coverage of medications for quitting smoking so that there's currently no annual limits. You used to only be able to receive a couple courses of treatment per year, but now there's no annual limit on that. So patients and community members, they can make as many quit attempts as they want during the year and really use as much medication as recommended by their provider. They also don't need prior authorization to be able to obtain coverage for these medications. New York State also, New York State also covers cessation counseling provided by healthcare providers. So this is really good to know in terms of if you're on the provider side, counseling can be billed, and so there is that kind of financial, reimbursement for providers to do that in-person cessation counseling for their patients. For folks that don't have Medicaid, so Medicare or private employer-based insurance, it's a little bit more variable, particularly the private plans. So I would just recommend, having patients talk to their insurance company to find out what type of coverage they have for medications. And then Medicare is really good. They cover prescription medications, non-managed care. Medicare is a little bit more variable in terms of what kind of managed care plan they're on, but patients and community members can reach out to find out what their specific plan covers. So insurance coverage has made a lot of strides in the last few years as far as covering these medications with either zero or very little copay. Next slide.
So Erin, you want to continue? I'm sorry.
Oh, Binh, you're back. Oh,
yes.
Good.
Got cut, so
Welcome back. Oh, no, go ahead and continue.
I'm calling from my phone. So yeah, thank you, Erin, for covering for me while I'm trying to get back on. So the New York State Smoker Quit Line also provide 2 weeks of supply of NRT and phone counseling as well. If you're not interested in talking to someone, you can also join the smokefree.gov offer free text messaging that provides 24/7 encouragement, advice, and tips for quitting. And then we also have the Asian Smoker Quit Line. Not Asian Quit Line. It's the Asian American for Equality Smoker Navigator Program. It's a nonprofit organization that works in partnership with. The next slide, please, Dina. I'm sorry, because I can't move the slide on my phone. Sorry. Thank you. The next slide, please. So yes, the Asian American for Equality Smoker Navigator Program is a nonprofit organization that we work with to offer brief cessation service to Asian American in New York City. They only offer brief counseling cessation service, but then after that, they refer you to the Asian Smoker Quit Line for more intensive counseling. Due to COVID, they're only offering one-to-one counseling and a 2 weeks follow-up. You receive free NRT, neither nicotine gum, with or patches, and it will be mailed directly to the smoker. The counseling is offered in English, Cantonese, and Mandarin. Next slide, please, Dina. So we have the Asian Smoker Quit Line that I spoke earlier. They offer more intensive counseling. It's long-term, as long as you need them. They give free 2 weeks starter kits of nicotine for those who are qualified. They have more different language accessibility. They have Korean and Vietnamese counselor in addition to Cantonese and Mandarin. So there's a direct line. We'll be sharing these information on our community member cessation quit list. So this is Quit. It's a free and anonymous text messaging program from Truth Initiative. It's designed to help young people quit vaping. After you enroll, you usually receive one age-appropriate message per day, tailored to the enrollment date or quit date, which can be set and reset. Those who are not ready to quit receive at least 4 weeks of message, focused on building skill and confidence. User with a quit date will receive 1 week of message prior to the date, at least 8 weeks of message after the quit line. So there's a continuous support until you're 100% quit vaping. And last, we have the LGBT Health Link. It's a national health LGBT health organization that eliminates tobacco use, reduce cancer, and bring awareness about health disparity in the LGBT community. You can also use our local cessation program. Visit nyc.gov and search health map to find local smoking programs. The map is very useful. You can filter based on different criteria such as cost, location, insurance as well. That's it. I apologize for the technically. That's our most inner fear for any speaker. Yep. Okay, so we have next is our Q&A open session. Dina, you want is there any question? Anyone can unmute their phone if they have any question that they want to bring up or any concern that they have experienced with working with community member regarding smoking or quitting. Or you can put the question in the chat too if you like. Can you see the chat?
Sorry, now I'm running into technical issues. But thank you so much, Binh and Erin. That was really, really informative. If anyone has any questions, please feel free to type them into the chat box or to take yourself off of mute. We do have a couple of questions that have already been submitted, so we can begin with those. Someone asked if you will be discussing at the next session information about e-cigarette use and prevention for young adults.
Yes, we are actually. Please save the date for our next tobacco webinar series, which will be presented by the New York Department of Health Tobacco Policy and Program. It will be specifically focusing on e-cigarette, alternative products such as marijuana, and talking about resources to assist youth and young adults interested in quitting. So we'll be sending out information to register in the coming week. So look out for the email. The next one will definitely focus just on e-cigarette and other alternatives such as marijuana. That is becoming legalized in New York State, yes.
Thank you. The next question is, do electronic cigarettes cause the same effects on the human body as regular cigarettes?
Well, you know, in my slide, we did say that, you know, studies are being studied, but, you know, as we are aware that they use a lot of flavor and other chemical that impacts our lung. So researchers are still studying the long-term impact of it. But people who do smoke e-cigarette, you know, are more immune to getting sick because it impacts their lungs.
Mm-hmm. Thank you. The next question is, how effective are lozenges to quit smoking?
Well, with lozenges, it's hard to say because some people don't like lozenges because they don't really like the taste of it. Sometimes they think it's too minty, or, you know, it's hard to say. It's the preference of the smoker. I have never, you know, really, it's hard to say. Erin, what do you think?
Yeah, I agree with that. Some people like lozenges, some people like gum, some people like the patches. They've all been shown to be effective, you know, in rigorous research to help with cravings and improve smoking cessation rates. It just kind of depends, you know, some people with dentures can't use the gum, so they like the lozenge. We like to encourage that people try different things and really find the type of NRT that works best for them. The lozenge is considered like a short acting, so it's one that you would you know, suck on during the day to try to avoid cravings. And the gum is the same type. It's a short acting to kind of alleviate cravings during the day. But a lot of people like the lozenges. A lot of folks that are in the programs that I work with, they like the lozenge. It's a little bit easier to use than the gum. You have to sort of, the gum you chew and you park it, you know, within your gums, which some people don't like. So a lot of it comes down to preference, but they've all been shown to help, you know, curb cravings and help people quit.
I have heard that people don't like the gum because it gets really hard,
Mm-hmm.
you know, because I chew it, you know, it gets really hard and they end up feeling like, at least the lozenge lasts a little bit longer because it's like a candy, which you kind of like suck on it slowly to release the nicotine.
Yeah.
We have a comment saying that most insurances do not cover the lozenge. Is that correct?
If you ask your medical provider to write a prescription, you are able to get it.
Mm-hmm.
Yes, if you have, I'm not sure about the private insurance, but at least, Medicaid does cover.
Great, thank you. The next question is, can you discuss the role of social support as a strategy to quit smoking?
Erin, I will need your support on that.
Yeah, social support is a big one, especially if folks have other friends or family who use cigarettes, that environmental exposure or social norming around smoking can be a big barrier. And so when we're talking with our patients around smoking, we definitely like to talk with them about who else in their family or their social circle does smoke, and try to engage them in a conversation around can they, get those folks in their lives to help them along in their quitting process. So sometimes it does involve, creating quit buddies, so trying to quit together, or at least if the friend or the family member doesn't want to quit themselves, at least helping them get on board with, the individual's own quit process and being supportive and not being, another sort of smoking trigger or encouraging smoking in them. So the social support is huge, especially if you're, talking about folks that have stress-related smoking behaviors. They might be smoking because there's stress in their lives. You can also help them engage their social supports around stress relief or other activities that distract them from smoking. So the social system is really huge in terms of quitting smoking, both in terms of engaging folks to help them along in their quit process, as well as making sure that other smokers in their life don't introduce smoking triggers or continue a smoking environment that can help or make it hard for the person to quit.
And it's also nice if you can involve family members, because we always want to bring up the concern of secondhand smoke in family, in houses. So sometimes, if the father smoked, the child can be like the support saying, Dad, secondhand smoke can impact the family, the health. So, there's a lot of way that, we can have a buddy system from friends or from families that can actually kind of like motivate the smoker to quit as well too.
Thank you. Folks can feel free to take themselves off of mute to ask questions. I have one ready to go, but if anyone wants to jump in, please feel free to do so. All right. Well, do you have any memorable testimonials from those who have quit smoking? Maybe you could share a success story that can help patients move from the contemplation phase that you've used before.
From my experience, I'm sorry to say I have not had a success rate before, but I have many clients I work with that have tried to quit, but then they realize it's very challenging. But in my experience, a lot of them quit is because of health reason. That is the main reason why they would quit. They know that nicotine is very bad for the health, but they always say it's very challenging. And a lot of times they would try 10, 20 times just to quit. But one success is after, it was actually the daughter who said, could you please quit, because I'm really concerned for your health. I want you to be able to see the grandchildren. So things like that are story that I hear from smoker who is not themselves, but because they quit for other people a lot of time. Mm-hmm. That's my experience with helping smokers.
Yeah, if it would be helpful, we can put together some, testimonials of patients that we've worked with over the years. Because I agree with Binh, it's most of the folks that I've worked with are a little bit older in life, and they've been trying to quit their whole lives, and then they keep trying and keep trying and keep trying, and all it takes is one time for it to work. And so we always encourage people that the more times you try to quit, the more chances you're giving yourself to succeed. And it is very, very hard, but we've had just a ton of folks over the years, for a variety of reasons, they're able to finally make it happen. And it is often in response to health concerns, or they want to be around for their grandchildren, or their kids are asking them to quit, or they just have decided for themselves, like this is the time that I'm gonna make it stick.
But sometimes I realize a lot of smokers don't realize the financial cost. That's why we share that one slide, like what it costs to quit. They don't realize how much money they're spending on cigarette a day. Even though New York City is $14, but it's probably pretty expensive in New York State. But to think about the money you can save and the money that you can put into other, buying other stuff or doing other stuff is something that we like to bring up to our smoker. And then they realize, oh, I could save a lot more money just by cutting down even one cigarette. Like instead of smoking a pack a week, maybe smoke one cigarette a day. Just the idea of like a harm reduction, trying to decrease the number of cigarettes they would smoke in a day. It's a process. It doesn't happen overnight, but the idea is to find motivation for them to quit.
Thank you. If there are no other questions, I am going to launch the poll that we would love for you to fill out. Your feedback is very important to us as we continue our programming for the Community Health Worker Research and Resource Center and the tobacco-free community at NYU Langone. It is really wonderful to have you all here with us today. Please do join us on May 18th. I will be sending out invitations to the second webinar of this series.
Yes, May 18th from 1 to 2 p.m.
Yes. Thank you, Stephanie, for your comment saying that that's what made your dad quit. He did the math and he never smoked again.
Oh, great.
That's wonderful. And we will be sending out the slides and the recording, as I mentioned earlier. And yeah, Erin, Binh, thank you all so much.
No, thank you for inviting us.
Just going to keep the poll up for a little bit longer for folks to fill out. Please take care and feel free to reach out if you have any questions. You have our emails from the registration. Thank you.